Hey everyone, Dr. Tam here. I want to tell you the truth about peripheral neuropathy. What it is, what are the causes, how are people attracting that to their life? How do you get it, right? And then what are some of the treatments that could really help peripheral neuropathy as well? So to start off, peripheral neuropathy is a nerve disease where you might get tingling, burning in your hands and feet. Sometimes it might feel like ants crawling up, your feet might be on fire. These are all symptoms of peripheral neuropathy. Although peripheral neuropathy is a nerve disease, but have you ever thought about where does it actually come from? It's actually coming from a lack of blood flow problem, right? Now, most people who have peripheral neuropathy, a majority of them, are diabetics. 70 to 80% of people with diabetes will eventually end up with some form of neuropathy if you don't take great care of yourself. How does that work? That's because with diabetes is too much sugar in the body. When you have too much sugar in the body, it's like acid to your pipes at home. It eats away the blood vessels. When it starts deteriorating and eating away the blood vessels, well, now the nerves that are furthest away from your heart, right, which is usually your feet and your toes, they start to deteriorate as well. When they deteriorate, it's going to send a message from your feet all the way back to your brain telling you that, hey, your feet, there's a problem down there. Now, it might come in, these messages into your brain might come in forms of burning, tingling, stabbing, right? Like you're on fire. So you just never know what it's going to be. Sometimes it starts off as an ache. Sometimes it starts off as pain in the bottom of your foot, and then you get misdiagnosed for plantar fasciitis, right? It can run all the way up to your knees, maybe even above it when it gets bad enough, but usually not above the knees. So the fact that it's a blood flow problem, what do you got to do with it, right? Now that's only for diabetic neuropathy. Then you also have chemotherapy or cancer treatment induced neuropathy, where chemotherapy is toxic to the body and it deteriorates once again the blood vessels furthest away from your heart. Now, why is it the blood vessels and the nerves furthest away from your heart get affected? Is because the nerves and blood vessels furthest away just have less blood flow. It's like if you were watering your lawn and you hook up all the water lines, right? The pressure at the end of the line just gets a little bit less water, whereas at the earlier in the line gets a little bit more water. And that's why the feet usually ends up being affected first, and then eventually the fingertips and the hands and elbows, right? So that's peripheral neuropathy. Now, the causes of peripheral neuropathy, as I've mentioned, could be from diabetes, could be chemotherapy induced, alcohol induced, some form of autoimmune disease. Certain medications can induce it as well. Multiple different things can induce it. The key to really overcoming peripheral neuropathy is getting to the root cause of the problem. What we do best is finding out what the root cause of the problem is and really treating that problem in order for your neuropathy to start getting better. For example, with people with diabetes, we change up exactly what they eat, right? But on top of changing what you eat, you can't just change what you eat and have the nerves and the blood vessels starting to heal. You have to apply outside source, whether it's light source, vibration therapy, right? Exercises to really boost the healing of the nerves. That's what we do in our office. I hope you really learned a lot about what peripheral neuropathy really is. Drugs and medications are usually prescribed for it, right? Gabapentin, Neurontin, Lyrica, Cymbalta. These are some of the medications that are prescribed for peripheral neuropathy. But how that works is many of these are anti-seizure medications that turns off the brain. And that is why when you take some of these medications, you may feel groggy, feeling like you are fatigued all the time. You have no drive, your mood is changed because it's turning off your brain slowly, because these messages from your feet can't break through that barrier into your brain. So you technically don't feel it, but you start losing your balance, and it just ends up affecting every parts of life, your work, your family, your friends, your relationships, okay? So what we do here, our mission at Absolute Integrative Physical Medicine, is to take people with chronic pain like peripheral neuropathy and help you get your life back without the use of drugs and surgery. That's our model. That's what we do. I talk about that in my book, The Truth About Chronic Pain. Pick it up on Amazon or come into the office and get one. I would love to have you read it. But overall, I hope you learned a lot about peripheral neuropathy. Have a great day. And if you really like this video, smash the like button, subscribe, hit the bell, give me your comments. If you love it, tell me you love it. If you don't like it, tell me why you don't like it. All right? We'll see you next time.